Hi, my name is Dr. Kosj Yamoah. I am a radiation oncologist at the Moffitt Cancer Center. And this year, I'll be presenting our clinical trial that involved men treated at the Moffitt Cancer Center, including the Veterans Affairs hospitals in the Tampa Bay area. And this study is registered in the clinicaltrials.gov, known as the VanDAAM study. It's a prospective validation of the genomic classifier, which defines a high metastatic risk in a subset of African American men with early localized prostate cancer. So prostate cancer disparity is a very complex problem, which has sources in racial inequality as well as underlying socioeconomic determinants that ultimately impacts biology, because at a cellular level there are differences in the way the tumor grows. We know it occurs younger in African American men, and the frequency, the incidence, and the mortality is also higher. And so with incidence being high and early age being also an issue, you begin to want to understand why that is. And so part of this specific clinical study was to remove some of the barriers to access by generating a clinical study that actually prioritized enrollment of African American men. So this novel, innovative study design was such that we would enroll an African American patient with prostate cancer and understand the disease characteristics, the disease burden by using clinical features, and then match that patient with a non-African American counterpart, and then do genomics on their tumor tissue, and then watch to see how the genomics matches up with their clinical picture. And in summary, this study really reveals some interesting observations that allows us to really begin to understand how to address the disparities from multiple angles. One being, allowing increased access to care, which is a great equalizer to outcomes, but also understanding how to personalize the care to the subset of African American men who may have a different type of aggressive disease, even when it's supposed to be diagnosed at an earlier stage. However, there are some biological differences that means that the treatments might need to be intensified because of some underlying genomic features that we are beginning to understand. So collectively, this will be the direction to really attempt to eliminate racial disparities in prostate cancer.